So we can have the next question here is cell lineage obtained from a 45-year-old Caucasian. Oh man, Caucasian again. So Caucasian male demonstrate unusually high replicative potential. It means that the cell lineage which we obtained from the 45-year-old Caucasian male is having high replicative potential or some kind of tumor. An activating mutation of which of the following gene is most likely present in this lineage? As you can have from the question is that from these genes we have to find one gene which is when activated can cause tumor. So there are these genes. First of all, we can have the literature here. Abnormal growth of neoplastic cells can arise secondary to mutation of proto-oncogenes or anti-oncogenes. Proto-oncogenes mean genes involving in the oncogenesis, and anti-oncogenes means genes which are not involved in the oncogenesis or protect us from the oncogenesis. So the proto-oncogenes stimulate proliferation, as we have discussed here in first line, and anti-oncogenes in contrast are tumor suppressor genes that inhibit cell proliferation. So these are both opposite. Of all the choices above, only KRAS is a proto-oncogenes. So guys, there is no concept here. You just have to learn which is proto-oncogenes and which is anti-oncogenes. So in this, KRAS is a proto-oncogenes. KRAS is often activated in tumor cells. So this is a table in which there are mentioned some kind of proto-oncogenes or anti-oncogenes. Not to learn these, just learn anti-oncogenes which suppress the tumor. We are familiar with these BRCA1 and BRCA2. These are DNA repair genes which are involved in the breast and ovarian cancer. You know it already. NF, neurofibromatosis. NF mean so neurofibromatosis type 1, some kind of sarcomas and neuroblastomas which are protected by these genes. But when there is some mutation, we can have neuroblastoma, neurofibromatosis type 1 and some kind of sarcomas. APC mean adenomatous polyposis coli genes which protect us from this kind of cancer. And beta catenin, these are involved in gastric, colonic and pancreatic cells cancers. So DCC, these are involved in the colon cancer. P53 is a very important tumor suppressor gene. These are involved in majority of cancers. Most important is Lee-Fraumeni syndrome. RB, retinoblastoma, osteosarcoma and other tumors. VT means Wilm tumor type 1. These are involved in the Wilm tumors. So why not this retinoblastoma? We have discussed here that retinoblastoma is a tumor suppressor gene which is involved in which suppress the transition of cells from G1 to S phase and protects us from these retinoblastomas. So BRCA1, the C option is BRCA1. We have already discussed it that it is responsible for DNA repair and protect us from the breast and ovarian cancer. We can see P53. P53 is a very important tumor suppressor gene and it also protects us from a lot of cancers. And EAPC, adenomatous polyposis coli, it also a tumor suppressor gene and protect us from familial adenomatous polyposis coli and a lot of sporadic colon cancers. The activation of proto-oncogenes can result in cancer, and inactivation of anti-oncogenes can also lead to cancer.